Hi, my name is Sam Kenninger. I'm the clinical educator for Good Sam's Emergency Department.
My name is Cece Metzner. I am one of the Good Samaritan Emergency Department nurses.
And today we're going to record a video on how to set up your equipment to initiate an arterial line. For the rest of this video, Cece is going to walk us through on how to do so.
So the first step in our process for getting an arterial line set up is knowing where to find your resources. So every department should have the central line cart, and included in the central line cart you should have all of your resources along with just additional information on kind of how to set it up and the supplies that you're going to need for it. So just a little quick run through. The first thing that we're going to need is a pressure bag, which we have here. Next, you're going to need either a 500 or 1,000 ml bag of normal saline. Then you're going to need your actual arterial line tubing or your vamp tubing. You are also going to need your monitor cord that's going to hook into your monitor so that we can get the actual arterial line blood pressure readings. We're going to need an IV pole with a transducer holder on it that you can move up and down. And then our final little piece is just making sure that your monitor has a spot to plug in your arterial line cable. So the next step in the process is going to be actually putting the transducer and the plunger into the transducer holder. So to do this, we're going to take our transducer, which is this piece, and you're going to want this white piece to be up, so you're just going to slide it in. And then our plunger is going to flip over. This white piece is also going to be up, so you're going to just slide this right next to it. When you do this, you need to make sure that this is parallel, so this is up and down like it is right now, and then that this port is off. The next step in our process is going to be just locking our actual plunger in place so that we don't get a bunch of air when we go to prime it. Then we're going to hook this into the monitor up here. And then this piece, this cord is going to go to this white piece that should be coming out the bottom of this. Next, we're going to get our either liter bag or 500 bag of normal saline set up. And our pressure bag. All right, so our next step in this process is going to be actually priming our arterial line tubing. So before we do this, we're just going to make sure that all of our connections are tight, because sometimes they do come loose when you actually get them out of the kit that we start with. And then just making sure that this piece is in the locked position as well. All right, so then next we're gonna actually burp this bag just to make sure that we don't have any air that's getting into our arterial line, so we can go ahead and do that. All right, and then we're locked, so I can just go ahead and fill up my drip chamber. Okay, and then just double checking that we have all of our, all of these are in the correct position. So this is up and then this is off. Thank you. And then I'm able to go ahead and undo this. And then to actually prime it, we're gonna pull this little blue cord here. And you should see it going all the way through.
So yeah, I looked at the wraparound one.
All right, and then I've got water coming out, or saline coming out of that, so I know that it's primed. And then I'm gonna put it on my pressure bag and inflate it up to 300 millimeters of mercury. So our next step, now that our pressure bag is inflated to 300 millimeters of mercury, you should be looking for this green. You want to put this in the up position so that it's locked and it's not going to leak any. And then now that our valves are also in the right spot, since we had so much difficulty with that the last time, We're going to make sure that our transducer holder is at the level of the patient's phlebostatic axis. So in this situation, our bed is our patient, so we would just drop it down a little bit. Looks like it's at about the correct position, and we're good to go ahead and zero our arterial line. So in order to do this, we're going to flip this valve up, and then we have to take this cap off, and we're going to go up to our monitor and turn it on. At this point, you're not going to have any type of arterial waveform because it's not hooked up to anything. But we're going to hit this value over here. And then we can go down, hit 0 AVP. Whoops. 0 AVP. And then you're going to get the 0. And now we know that it is good to go and good to hook up to our patient. And then to actually use it, we're gonna put, this cap is gonna come in our kit. So we're gonna put this new cap back on. If I can open it. So this will go back onto here. This we're gonna flip back over, and this is the position that you want it to be in when you're actually hooked into your patient to get a correct reading. And then we're gonna be good just to hook this into the arterial line that the doctor places. That's it.